Have there been any setbacks or complications along the way during your rehabilitation and recovery?
Actually, not over much following the original operation, but certainly in the last year, or actually just before that, when we were diagnosed with gallbladder problem, and we were going to have the gallbladder out. That actually took place in Easter of this year. That's 2013, of course.
Yeah.
That was done by keyhole surgery, not too difficult at all, but the only problem with that was that shortly afterwards we had an infection which had to be drained.
Okay.
That almost came straight afterwards. Subsequent to that, almost immediately, we had continuing problems with trying to eat, where it was thought that the cancer of the esophagus might have come back.
I see.
Although having just had the gallbladder problems out, they were all, I think, looking at that it might have been a problem with that, until they did further tests and realised that there was a restriction in the stomach area where it met the duodenum.
Yes.
Okay.
And what did it turn out to be then, or has that not been answered yet?
Well, strangely enough, it's not actually been diagnosed. They anticipated that it might have been a recurrence of cancer. And when they did an endoscopy, there was no sign of any change there. So they thought that there might have been a cancer on the outside of the area where the restriction was. And so we had a CT scan that made a comparison with one which was done sort of 3 months beforehand.
I see.
And there was absolutely no difference at all. So they realised that there wasn't, or at least it doesn't seem, that cancer has reappeared.
Well, that's good news. Although it would be nice to get an answer what is going on.
Yes, I'm a bit of an enigma because they don't know.
What problem is it causing regarding your lifestyle, stroke, eating at the moment?
Right, well, because there was a restriction, food wasn't going through at all, and we were actually losing weight quite rapidly. And we had to have, what's it called, PNT?
A peg feed?
Parental feed.
Parental, with the intravenous?
Intravenous, yeah.
Yeah.
For 2 weeks.
Yeah.
And that was followed by an operation where they were hoping to do a Roux-en-Y bypass operation. And then they realised that they weren't able to do that because of the reconfiguration of the original operation back in October 2010.
Yes.
So the next best thing was to put a stent in to open up a gap so that it allow for the passage of food.
And that's what they've done?
That's what they've done, yeah.
And has it alleviated your symptoms?
It's alleviated the symptoms in as much as we can now eat, although with difficulty with certain types of food. So it's quite, I imagine it's quite a rare condition that we're in, position that we're in now.
It's very anxiety provoking when you have a new symptom which could be a recurrence of the cancer.
Yes.
How do you manage that worry in a way?
It was a worry to start off with until we were told that it wasn't a recurrence.
Yes.
But then we've got to relearn, I think, all the eating habits that we'd forgotten about from the original, you know.
Exactly. You have to restart with a more restrictive pattern.
Yes. Yes.
But do you have any methods, coping styles or advice regarding managing in an uncertain situation?
I don't know. That's a difficult question, I think.
It is difficult, yes.
Yeah.
And what I'm really asking is, do you have a way of getting through things when things get difficult like this?
Do I have a way of getting through things? I'm a philosophical person, yes. You get through somehow. You work your way through things, yeah. Sometimes with a little bit of difficulty.